It is 8:35 right now. Another case of measles confirmed in New Jersey, this time in Passaic County, raising growing concerns about the spread of this very contagious and potentially deadly virus. In fact, in a couple of cases nationwide, it has been. The state's Department of Health saying the recent cases do not appear to be connected, but with increased international travel, it's the summertime, of course, and outbreaks across the South, experts are watching closely. Joining us now is Dr. Jay Reddy, Chief Science Officer at HealthTrackRx, a national infectious disease detection lab, to help us understand what this means for our region and what steps can be taken to stay safe. Good morning to you, Dr. Reddy. Good to have you back on.
Thank you very much. Good to be here.
You bet. And we're seeing isolated measles cases in a number of counties in New Jersey. So how concerning is that? And what do we know about this latest case?
The latest case is from international travel. This is historically what we've seen even after we had measles eradicated in the early 2000s. We did see it pop up through international travel. It just would not spread endemically in the United States. The worry now is we have falling vaccination rates, and with those falling vaccination rates, we allow the chance when someone comes from international travel carrying measles to spread that here in the U.S. Luckily, we're figuring out this case is not related to any of the other previous cases, but the worry is if any people have been unvaccinated and got in contact with this person, there's a high chance that other people will be infected with the virus.
And one thing we do know, we have this case in Passaic County. And Passaic County is a county of about 530,000 people. We know that as of 2019, the state had surveyed and figured that there were about 40,000 individuals who were illegal migrants. And I'm not, by the way, let me just clarify, we don't know that this is a case from illegal migrants. So I don't want to impugn or imply. But when you are dealing with, in that case, 40,000, and now it's anywhere from 75 to 100,000 illegal migrants in a county of 500,000, that's 20% of the population. We don't know what their vaccine record is. They may be 100% vaccinated. They may be zero vaccinated. What kind of potential impact does that have? And as a health expert, when you are dealing with, you like to deal with data, right? You want to know 200,000 people have been vaccinated and we have 2 cases or whatever. But when you don't know, when you have an outlier, not an outlier, in this case, you have an unknown, where potentially 100,000 people we don't have any knowledge of their records. What does that do for your ability to predict?
It gives you no ability to predict. You have numbers that create kind of herd immunity in the community, which is right around 95%. If you have 20% of a population whose vaccination status is unknown, that opens up clearly the opportunity for measles to spread. And really the scary thing about measles is it can stay latent for 7 to 14, up to 20 days, where that person is actively spreading the infection to other people without showing any really visible symptoms. So the latency period is where the scary part is, because they could be walking around the mall with just a normal sore throat. And if you have 20% of the population that is unvaccinated or vaccination status unknown, it's ripe conditions for measles spread.
Well, the good news is your company, HealthTrackRx, it's spelled, we've had this discussion in the past, it's spelled HealthTrackRx, right? So for people who want to look it up online, but we call it HealthTrackRx. The good news is you have rapid testing that can be done very quickly in facilities, send it out, and by next morning you get details. Talk about that.
Well, the number one thing to prevent spread other than vaccination is quickly identifying people who have measles. So if someone does walk in with a sore throat, if someone does walk in with a fever before they're showing the obvious signs of a rash, the quicker you're able to diagnose an infection, the quicker you're able to put in the proper measures for people not to continue spreading that around the community. So having answers to quick results is imperative for any infectious disease, but especially measles.
So essential, because as we know, one of the cases a few months ago, the individual, not knowing, they thought they had a little upper respiratory or whatever, and they went from place to place to place to place. They went to a private doctor, they went to an urgent care, they went to an emergency room, they were in a mall, they went and got coffee, and each place that they stopped, it's all you got to do, right? And that virus lingers on the counter, in the air, whatever. As you mentioned, this is a virus that doesn't just dissipate in an hour and go away. Like COVID can dissipate relatively quickly. Measles sticks around like glue.
Yeah, people aren't walking around the mall typically with 103, 104, 105-degree temperature, but when those symptoms are mild with just a runny nose or a slight sore throat, which can happen again for up to 2 to 3 weeks after getting the infection, you're spreading that everywhere you go. Not every urgent care has access to a measles test. So if you're walking into a place, they might not be able to do that testing. And a lot of times it takes 4 or 5 days to get a result back. Really not great for someone trying to figure out whether they have measles, whether they should isolate, whether they can go to the grocery store, whether they can send their kid to school. So the quicker you get an answer, the quicker you can kind of return to normal life activities.
Definitely. And you guys offering this test, it's wonderful. What does your test do? What is it, just a swab test or is it a blood test? And how quickly do they get results?
It's a swab test, and if a sample is collected today, it is going to be resulted by 8 a.m. the following day. So we have next morning results for everyone across the country, whether you're in a metropolitan area or rural area. So if you go to your
And
local urgent care or family practice or pediatric doctor and ask for a HealthTrack measles test, they likely have it.
and tell everybody, it was so fascinating. It was so fascinating to hear the last time we had you folks on how you're able to do it so quickly. I love the fact that you're associated with the airport. Talk about that.
Yeah, we have an association with UPS, so a partnership where we're able to get samples all across the United States into our facilities early in the morning. We run our shifts overnight, starting at midnight, to make sure we provide answers to patients and providers early AM. And really, it's about creating partnerships, across the spectrum with public health laboratories and with the advice of the CDC in developing this test in the first place. We were waiting. We've been having this request for the past couple of years for measles testing. Didn't feel like it was the right time based on, kind of the spread wasn't big. The amount of states touched wasn't very high. This year was the year that we could see we really could have an impact on patient lives.
Yeah, something like this can spread exponentially, obviously. There are 1,300 confirmed cases. There could be thousands more that we don't know of, right? So this is something that we have to take very seriously. Here we thought we eradicated it 25 years ago. But at this point now, all you need is a few pockets and people who don't realize that they are contagious, that they are harboring the disease, and this could spread like wildfire. Not to frighten people, but would you say that doing the normal preventive measures, hand washing, the not touching your nose and your eyes, the using the hand sanitizers and things like that, should we be doing that more than ever right now?
Yes, public hygiene is a really good thing. What I will say is measles is more transmissible than most other respiratory viruses. It is one of the top two up there. Really, the key to prevention is vaccination. The vaccination for measles, unlike flu or COVID, where really that is priming your body to fight the disease once you get it, to prevent severe disease. It's not preventing getting the disease itself. Measles prevents getting the disease in the first place. You can eradicate measles almost 100% by getting the vaccination. If you don't get the vaccination, it's very hard with how long measles can linger in the air, how transmissible it is, to avoid getting it if you're not vaccinated and you're exposed to someone who has measles.
Gotcha. Give everybody your website again, also for health organizations that want to get access to your test kits.
Yeah, if you go to www.healthtrackrx.com.
All right, very good. Dr. Jay Reddy, Chief Science Officer at HealthTrackRx, which I know on the quick you pronounce it HealthTracks as well.
Yeah,
Thank you
it's
for joining
easy.
us this morning. Yeah, really, that's a good way to remember, but it's HealthTrackRx, right? HealthTrackRx.com. Dr. Reddy, thank you so much. Good to have you on today.
Thank you. Take care.
You bet, you too.